Welcome back. It was clear right out of the gate that the coronavirus was disproportionately affecting communities of color. The governor assembled a task force led by Lieutenant Governor Garland Gilchrist, which this week released findings on a new study on the virus. And the Lieutenant Governor joins us now. And this report, in the midst of all this bad news that we've had, you really had some things to brag about this past week. Not brag about, but some very positive signs to show that we've actually made a difference in a community that I'm not sure a lot of people thought we could do in such a short period of time.
Well, Devin, thank you for having me on to talk about this. And, what we wanted to report is that we have made progress on dealing with one of the deepest challenges that presented itself with this coronavirus pandemic. Early in the pandemic, we saw that this virus was 5 times more likely to kill a Black person than it was to kill a white person in Michigan. We saw that while we make up 14% of the population, Black folks made up 41% of the deaths in March and in April. And so we stood up this task force thanks to Governor Whitmer's leadership. I'm proud to chair it alongside some really fantastic minds from different areas of life, from epidemiology to faith leaders to young parents to medical doctors to academics and everyone in between. And we did some things that have had an impact. But that collective impact is attributable to the fact that we chose to prioritize this uniquely. No other state has put as much focus on racial disparities as we have. And because of that, we've been able to slow the spread of the virus in the Black community in particular, and in communities of color across the board. And we're really proud of that work.
In fact, we're also seeing that now the city of Detroit has a positive test rate that is much lower than a number of other locations around the state. I think it's inescapable. The upshot here is that mitigation measures actually can work.
Absolutely. When we follow the advice of public health experts in Michigan, we slow the spread of COVID-19. We saw that earlier this year. And frankly, I'm proud of Detroiters and of people in southeastern Michigan who stepped up and did their part. They wore their masks. They practiced physical distancing. They were careful not to leave their home unless they needed to. And when they left their homes, they were careful. You couple that responsibility and that really, I think, commitment to protecting the community with the interventions that we put in place as recommendations from the task force, making 6 million masks available to people across the state, a targeted communications campaign so that people knew the importance of the public health measures, the Get Covered campaign to connect people with doctors and insurance through a new navigator program that we stood up to the Department of Health and Human Services. All these interventions have had an impact, and we're continuing to do the work because while we have had good news thus far, this fight is not over.
Well, that's
we still don't have a vaccine, and we still have work to do.
And that's what I wanted to get to next, because against this better news for certain populations, and the broader picture across the state right now is pretty dire. What are we not doing right yet?
Well, we have to follow the advice of public health experts. Like I said before, wearing masks work. And the advice that we've seen from experts that we need to continue to do so whenever we leave our homes and whenever we're meeting with people who are not part of our household. That's why that we've called on the legislature to pass a mask mandate. I'm actually happy to report that we now have a Republican member of the State House of Representatives that is calling for a mask mandate. And so we need to do these well understood public health measures to make sure that we can keep people safe and slow the spread of this virus so that we can get to the point where we have a vaccine that is actually available to people across the state of Michigan.
Well, as you know, though, critics of the administration still feel very frustrated that they don't fully understand the metrics. We had Senate Majority Leader Mike Shirkey come out this week saying, show us the exact metrics so that restaurateurs know what it is, what the breaking point is, at what level decisions are made. And by not knowing those metrics, that the sense remains among some Republicans that the governor and her health experts are still doing this on the back of a napkin every day, and that there's not something specific that can help these business owners make plans.
Yeah, we report the data and metrics on the michigan.gov/coronavirus website every single day. We've been transparent as far as releasing those numbers and case counts and positivity rates. And also, I was really disappointed to see that from the Senate Majority Leader because, frankly, he and the Republican leaders have been invited to the weekly data calls with the University of Michigan School of Public Health and other public health experts from around the country that talk about not only the current metrics, but also what we're trying to do in order to improve how we're experiencing the pandemic here in Michigan. And the Senate Majority Leader has not attended those meetings consistently. Otherwise, he would know the answer to the question that he posed.
Is there an answer? So there is an answer to the question? I mean, because you're right. The numbers are there every day. We reported on them almost every day. And we've got them. We put them out, of course, for everyone to see as well. And yet people want to know if there is what's the number that ticks certain decisions over, whether it's deciding on another 3-week sort of slowdown or in-person dining versus not allowing that? Is there a specific metric that tells us one way or the other where the needle goes?
Now, we don't have a tipping point like that. And I would actually look to the CDC and other public health expert bodies that really have shown that what the guidance that they're providing is saying that it's our practices that are going to help us slow the spread of this virus. And they'll get us to thresholds that we can then look at what kinds of activities have different levels of risk. And right now, what we know is true across the state of Michigan is that cases are growing. We're concerned about what happened over the Thanksgiving holiday, and we're waiting to see how that's going to impact hospitalizations. We're very concerned about things like the fact that so many hospital systems across the state of Michigan are at capacity. And so we have to do things to slow the spread so that we have enough hospital beds to take care of people. And that's just not true in enough places. And so we need to get there by working together, by wearing masks, by practicing physical distancing. And when we do that, we'll be able to not only protect our communities, but we'll be able to undergird our economic recovery.
And I'm afraid I got to leave it there. I'm right up against a break. But Lieutenant Governor, thank you so much for the time. Stay safe and Merry Christmas.
Devin, thank you for having me.
You bet. As always, run out of time before I run out of questions. Meet the Press is next. Have a great week. Stay safe. We'll see you next time on Flashpoint.